clue. Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Hi, good morning.
What more strict measures could he, do you see out there that he could enact?
Well, there's one race going on here that there's a clear winner, and this coronavirus. It's winning. It is just incredibly out of control in the Midwest, and Illinois has now caught up with some of these other states. Some of them are worse. Wisconsin is worse. So this is what a consolation. But it is what the mitigation is going to have. We know how to slow this thing down. You know, no crowds, no parties, no essential, only essential businesses open, like we did at the beginning in March and April. It's going in that direction, and it's going to be very soon. 10,000 new almost 10,000 new cases per day. You know, that translates into over 1,000 hospital beds. You know, hundreds of deaths. This is all coming in the next few weeks. It's going to be a very, very challenging, rough 2 months.
Well, that's not good news.
No matter what we do.
Let's talk about this idea that the coronavirus is more of a blood vessel disease, and if there's any clues, this is a study that I don't quite understand.
Yeah. We've been talking about this for the scientific community for the last actually 2 months or so. We know that there are receptors in the blood vessels that also can attract the virus. We also know that the blood vessels are susceptible to inflammation, which occurs with coronavirus. And it's very interesting because the people who have one of the highest risk group for having a complication are diabetics, and they have a vascular disease as well. That's what they call small vessel disease. You put the coronavirus vascular disease on top of the small vessel disease of diabetics, and it's frankly very, very difficult for those patients, more so than people that have chronic lung disease.
All right, let's get to viewer questions. With the importance of contact tracing when an employee tests positive, why aren't employers required to advise the rest of the staff who it is that is positive? Employees that were directly in contact could then take precautions until they can be tested. Why is HIPAA the law of the land during a pandemic?
Well, there's a couple issues in here. One is you're not sure really who's spreading what, but I think it is important that people that have been in contact be informed that somebody amongst them has been is infected. And I'm not sure exactly myself what the law is. I know in people I'm consulting with, hair salons and restaurants and stuff, what happens is when somebody does get infected, everybody is told that somebody there has been infected and that they have to be careful. So, that's probably the best way to go about it right now. Identifying a single person, that carries not only HIPAA, but a lot of risk for that person, especially in the current climate we have now. Is it really fair to put somebody like that out in public and anything could happen to that person? So I think if you just tell the people at work, that's enough. And then everyone is just be careful. You can go get tested. You can quarantine if you have to, or you can wait until you develop some kind of symptom.
All right. This person says, if I'm taking immunosuppressants for another disease, am I more prone to get COVID-19?
Well, it's not so much that this person is prone to get it, but if they get it, they're likely to do worse. So that's the problem.
All right, next question. If a person receives the vaccine, will they be able to carry the virus and pass it on to a person who has not yet gotten the vaccine?
I'm assuming that this is like from the vaccine.
Maybe that's what they yeah, I didn't understand that either.
That's what they're thinking. So that occurs with a live vaccine. The vaccines that are being developed for coronavirus are not live vaccines. You cannot give coronavirus to anybody after you have the vaccine.
All right. Well, if you have a question for Dr. Murphy, you can post it on our Morning News Facebook page. We'll talk to him again on Monday. Have a good weekend.